Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. We all know that social media can be very powerful, and it's a communication tool. It's a way for people to interact with each other and talk to each other. So forget the influencers and all of those that are the most popular, but the everyday person can get onto Twitter and put out some tweets and express their opinion on a lot of different things. And in this Journal Club episode today, I did want to talk about an article that was published specifically looking at tweets, looking at data from Twitter, and searching on a healthcare topic, which is mask wearing during the COVID-19 pandemic. Now, I don't want to focus specifically so much on the topic, but it was really interesting to see from a pharmacy informatics perspective that the authors of this article did researched a bunch of tweets, almost 1 million, and they used machine learning in their filtering of the information and analyzing the data. Artificial intelligence has been used a lot now, and we've talked about artificial intelligence in the area of pharmacy informatics, but in this article, you see that they're using artificial intelligence, specifically machine learning, to help with analysis of thousands and thousands of tweets. Let's get into the article. I want to talk a little bit about where it was published and then talk about the article itself. So let's talk about tweet analysis. Now, we have organizations such as HIMSS and AMIA that are not specifically pharmacy informatics organizations or even pharmacy organizations, but they are healthcare information technology organizations. So this is a rich area of content for the pharmacy informaticists. The Journal of the American Medical Informatics Association prints a lot of articles that are health information technology related, and many of them that are pharmacy informatics related directly. So on today's article, I'm not really addressing one of the pharmacy informatics topics specifically, but you can see that if you go and explore the journal, you'll see a lot of good articles written. This is a recent article from April of this year. And their question that they were researching was, why do people oppose mask wearing? And this is a comprehensive analysis of US tweets during the COVID-19 pandemic. And I'll just, give you the spoiler right at the beginning here. They found consistently there was about a 10% anti-mask sentiment expressed. Overwhelmingly, almost 90% of what they were seeing was positive towards mask wearing. So that was kind of the bottom line. But the interesting thing about this article is they started with 771,268 tweets. And they started looking for some keywords, which are listed at the bottom here. You see mask, face cover, cloth cover, face cloth, and other things that might indicate mask wearing. And what they did as a first step is they looked for all of these tweets that mentioned these keywords. And then they did a secondary search. They filtered it looking for opinions expressed about mask wearing. So it wasn't enough for them to say, oh, there's something about wearing masks that we're supposed to pay attention to. But they expressed an opinion about it. I don't want to wear a mask. I can't breathe when I wear a mask, or other opinions about mask wearing. And they had the computer help them with the filtering and analysis of the data. So they ended up with 267,152 tweets containing personal opinions towards mask wearing. And if you look at their materials and methods of their study, they said that they used a computer-aided qualitative analysis approach that combines machine learning and qualitative qualitative content analysis. So I've heard of this before. Before the COVID-19 pandemic, there were researchers, colleagues of mine actually, that were looking at epidemiology studies through social media. So they were looking for tweets, indications of people being sick, complaining about having the cold or the flu. And then they were analyzing kind of the wave of influenza infection across the country by, looking at location and looking for keywords and seeing, are people getting sick? Are they going to the hospital, or are they just staying home? What are they doing to treat themselves? And where are the hot spots in terms of, influenza infection during that cold season or that flu season? So this has been happening for a while, but it's interesting that with COVID-19, there was more of a focus on this. And I think that we'll see a lot more of this in the future, analyzing what's going on out there. We know that Twitter has been a hot topic when it comes to politics. And, people are always expressing their opinions, and that folds into healthcare and the health of our patients. And we can really probably learn a lot by doing these analyses of what's happening in social media. So very interesting article. I haven't done the search yet, but we could probably find a lot more articles along this line that are more specifically pharmacy related, and that might be of more interest. But I wanted to talk about this specific article, but because they did get into social media and using machine learning to help with filtering and analyzing the data. If this topic was interesting for you, please like the video and subscribe to my channel, and I will thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others. I'll continue to work on more episodes, and I hope to see you next time. Take care.